And so the president talked about the case fatality rates, and we've lost a lot of Americans to this disease, and we pray and hope for each one of them that are in the hospitals and the excellent care. What this graph illustrates is the amazing work of the American people to really adhere to social distancing. This was nothing we had ever attempted to do as a nation, and the world hadn't attempted to do. But they were able to decrease the number of cases so that in general, most of the metro areas never had an issue of complete crisis care of all of their hospitals in a region. And so you can see our case fatality rate is about half to a third of many of the other countries.
Excuse me, does anybody really believe this number? Does anybody really believe this number?
I put China on there so you could see how basically unrealistic this could be. When highly developed healthcare delivery systems of the United Kingdom and France and Belgium and Italy and Spain with extraordinary doctors and nurses and equipment have case fatality rates in the 20s up to 45, and Belgium is extraordinarily competent healthcare delivery system, and then China at 0.33. You realize that these numbers, then this includes the doubled number out of Wuhan. And so I want really to put it in perspective, but I wanted you also to see how great the care has been for every American that has been hospitalized.
Does anybody believe this number? Does anybody believe this number? You saw more
and this is why
bags on television than that.
This is why the reporting is so important. And I think you remember almost 6 weeks ago, maybe a month ago, I was telling you what Italy was showing to us and what France was telling to us and the warnings that they gave to us and said, be very careful. There's an extraordinary high mortality among people with pre-existing conditions. And we used their information to bring that to the American people. That alert before we even had significant cases, came from our European colleagues on the front line. And that's why we keep coming back to how important in a pandemic and a new disease, it's really critical to have that level of transparency because it changes how we work as a nation. It allowed us on over March 15th to make an alert out there about vulnerable individuals and the need to protect them, and my call out to millennials to really protect their parents, protect their grandparents, and get that information out to everyone, that there were pre-existing conditions that put people at greater risk. That information came from our European colleagues who were in the midst of their battle themselves. And so there is never an excuse to not share information. When you are the first country to have an outbreak, you really have a moral obligation to the world to not only talk about it, but provide that information that's critical to the rest of the world to really respond to this credibly. And I really want to thank our European colleagues who worked so hard to get us that information, even in the midst of their own tragedies. And I think that really shows how important transparency is.
Mr. President, you've mentioned, and the doctor mentioned China a few times today, that clearly suggesting that the data has not been good. And
Well, you tell me, do you think that data is good when you see that? Do you think that's correct, okay? Do you honestly believe that's correct?
Pretty dramatic contrast. So my question for
Dramatic?
you,
Yeah, that's dramatic.
So my question for you, sir, is
Why didn't the press, why didn't you people figure that out, though? Why do we have to put up a chart? The number is impossible. It's an impossible number to hit. But why haven't you come up and said that?
the question, sir, is China now cooperating with the United States to figure out what happened, and what do you want from them now?
Well, they said they're doing an investigation, So let's see what happens with their investigation. But we're doing investigations also.